Hi there. Thanks for joining me for the second in the series of videos on COVID-19. Today I'm going to be talking about preventive measures to take to keep yourself safe and well as those of your family members during this time. As an introduction, and I mentioned this in the prior video, that without a vaccine or drug treatment available for COVID, 60 to 70% of the population will need to be infected before we develop herd immunity. As I mentioned in the prior video, right now we're looking at less than 1% of the world population being affected. So we do have a long way to go, which means prevention is really going to be the key right now until we have more information. And again, this information could change tomorrow. We may have a cure tomorrow. We may have a vaccine in 6 months. But right now we don't have either of those things. So we have to be really serious about prevention. There is so much information out there about what we should be doing to protect ourselves. Opinions differ depending on what community you live in, where you live in the world, what your local officials believe, what your state officials believe. So it can be very, very confusing. And what I've done my best to do is to use the CDC guidelines, use research studies. I've tried to basically keep very up to date on not only what the government is saying, but also what scientists are saying, to provide the most up-to-date information I can provide. And all these things I'm recommending for you are what I'm recommending for myself and my family members. Okay, so the big issue here is that it's really imperative that we all take personal responsibility at this point. All right, and it's really going to be a cultural shift where we think about not only protecting ourselves, but also protecting those around us. Okay. So we know there are a number of measures that are really important. Hygiene, of course, is really important, and that involves doing a lot of hand washing. Hand washing, avoiding touching your face, and avoiding high-touch areas is really key. What happens when you have virus on your hands? You touch your face, that becomes the nidus for infection, is the facial area. So the goal is, in some cases, people are told to wash their hands at least 5 times daily for at least 20 seconds. That's a happy birthday times 2. Happy birthday to you song times 2 gets you about 20 seconds. If you don't have access to soap and water, which many of us don't, we come from the store, we don't have a sink in our car, keep a bottle of hand sanitizer in your car, get in your car, do a couple pumps, rub that around. You want that to be at least 60% alcohol to have a disinfecting effect. And again, avoiding high-touch areas. If you're at the store touching a lot of things, that's a whole other reason why you want to make sure that you keep your hands clean. And again, don't touch your face. That's key. Okay, masking. Okay, you're going to see all over the country. There's arguments about should you wear a mask? Do you need to wear a mask? I wholeheartedly believe that masking is key, and I mentioned in my prior video that a recent study that looked at the 3 epicenters for infections in Wuhan, New York City, and also in Italy, very well demonstrated that it looks as though masking is the key to prevention, largely because we are looking at the likelihood of aerosol transmission or airborne transmission of this disease. Okay. So, studies in Hong Kong, if you look at the cases in Hong Kong, are minimal, and that can be attributed to masking. That's what they do different. Also, low cases in Taiwan. The World Health Organization has just put out a statement saying that it is absolutely recommended that you wear a mask in public. CDC is sort of, I think, is the last that I saw this, and I'm trying to keep up to date, has recommended it, but the World Health Organization is saying this is something that everyone should be doing when they're out in public. Okay, what kind of masks? What kind of masks are best? So the best mask is something called an N95 mask. Okay, an N95 mask is actually called an N95 respirator. Fit properly, and there are certain ways that you determine whether your N95 mask fits properly. Prevent 99% of infection. They protect you, and they also protect others. The problem is these are not to be used by the general public until we can ensure that there are enough of those for healthcare workers and first responders. So right now it's not recommended that you go out and buy N95s because of the fact that there are people who may need that more. Now again, companies are making more of these things. They may become more accessible. But what we know is that, and surgical masks would be in the second line, and again, those are things like sort of the blue mask that surgeons would wear. They are helpful in protecting virus from spreading from the person who's wearing the mask, and probably offer some protection to the wearer as well. And then cloth masks. And cloth masks are perfectly fine. That is what you are going to have access to, most likely because you can make them on your own. Many people are making them and selling them. And there is evidence absolutely that they decrease transmission of this disease. We believe that all masking, more than likely the biggest effect is that it prevents, it sort of catches anything from an infected person into the mask so that it's not spread. But there is certainly a very good likelihood that the mask wearer is protected as well. So this is where you'll hear people say, well, I'm not sick, I don't need to wear a mask, I'm not sick. Well, number one, remember what I said, 30% of the infection spread can be attributed to people who are asymptomatic. So just because you don't feel sick doesn't mean you don't have the virus. So you want to think about that in terms of protecting other people. And then obviously, if you are sick, you want to protect other people as well if you actually have symptoms, okay? So let's see here. People ask about, linen or pillowcases, silk, scarves, probably less effective due to the way that the fiber is designed. If you wear a scarf or bandana, if that's all you have, you don't want to just drape it over your face and have it hanging down, because the virus can easily travel up. And of course, if you cough or sneeze, that stuff just spewed out. So you really want to have a good, not necessarily tight, but a good a cover that prevents things from escaping. I've seen a number of patients have come in with valve masks. So these are the masks that have a little valve on the outside, and it turns out that these masks are not safe. Okay, what those masks are designed usually for people who are involved in like maybe carpentry or have dust exposure, those sorts of things, because it allows them to prevent breathing in dangerous things, but they can still breathe out everything. Okay, so it allows them to sort of, it's an escape valve. And think about that. If you're infected, you're just, that infectious material is just escaping through the valve. So valve masks should not be used. There may be some very specialized equipment. Someone had mentioned like a P100 mask, which is, it sort of almost looks like a gas respirator type of thing. I'm not real familiar with those. I think before you look at any alternative masking, you want to really make sure that it's safe, and we can help you with that if there's questions. A cloth mask should be double layered. That's going to offer you the best protection. Many people who are making their home masks will have a little slot inside where you can place a filter, like a surgical mask filter if you have access to those, or putting anything in between there. That's another barrier. But we do know that masking works, and I think that's really going to be the key. And so masking, for me right now, and what I'm hearing from medical experts is that masking indoors is key. Masking indoors in public. If you are out in public and you go inside anywhere, you really should be wearing a mask. If you are outside, outdoors is always better because there's more airflow. Things are less likely to be lingering in the air. So outdoors, assuming you're not like in a pool with 800 people, outdoors is better, and masking is going to be less necessary. I don't want to say it's not, because we still just don't know. I'm even unsure, if I'm spending some time with a few friends and we're out on the deck, should we be masking? I haven't been, but I've been sort of distancing. Again, we're learning new things about this every day. So I say indoors for sure, you should be wearing a mask. Eye protection, healthcare workers are now it's being stressed that they have eye protection, because with large amounts of droplets, there can be transmission to the eye. We're not really advocating yet that you go out with an eye shield on. And then other people ask about gloves and whether they should be wearing gloves. And really, there's no evidence that gloves offer you any more protection than your hands, because you're going to be washing your hands anyway. If you're caring for someone who is sick with COVID, then gloves are a good idea. But otherwise, we're not really seeing much benefit to gloves. So if you're out shopping, we don't think that there's really any need to wear gloves. If you're wearing a cloth mask, make sure you wash your mask after use, okay? Because if there's particles that have landed on your mask, you don't want to be touching that and, spreading it everywhere. You want to wash that mask. When you wear a mask, it's important that when you put the mask on, you don't touch your face. When you pull the mask off, you don't touch your face. I think it's a good idea to wash your hands before you put your mask on or hand sanitize, and do that again before you take your mask off, so you're keeping your hands away from your face, okay? Okay, distancing, okay? So it is estimated that the distancing measures that have been put in place, a recent study suggested that it prevented 60 million coronavirus infections in the US, 285 million in China. And again, we're talking about lockdown. So like sort of lockdown, and also like if you're out, the spreading, okay? So it's a combination of those things. There was a study done in the Imperial College in London that suggested that 3.1 million lives in 11 European countries were saved by distancing measures, and dropped the infection rate by an average of 82%. Okay, so this entails maintaining a 6-foot difference. I just read something this morning about a 6.6 foot distance being ideal. Again, the whole point of that is that if you're not wearing a mask, which you should be, and you cough or sneeze, those respiratory droplets will land on the ground rather than on you, or rather than on other people. The distancing would obviously involve avoiding crowded places, spacing out your trips outside the home, so trying not to be outside of your home any more than you really need to be. If you leave your home outdoors is best, because of the ventilatory aspect of that, sort of allowing any particles that are in the air to be dispersed rather than sort of lingering. Keeping a close circle of friends is a good idea, maybe to a small group of individuals who are also taking the appropriate precautions. Avoiding public bathrooms, that's kind of my advice. I think that it's better just to, obviously if you're out and about and you have to go, you have to go. But I think avoiding them is a good idea. I do think there's the surface contamination risk in public bathrooms is probably pretty high. Okay. Decreasing your risk of everyday activities. Okay, so this is very tricky because there aren't really any hard, fast rules. A lot of this, the restrictions of daily activities is really founded by state and local governments. So I'm just going to talk briefly about what we are right now with Pennsylvania into sort of the yellow phase. Okay, and what does that mean? And it's very likely that in another week we're going to be moving into green phase, and I can certainly put out another video at that time. But right now, what the yellow phase means for Pennsylvania is that we continue telehealth when possible. So anything you can do at home, you should be doing at home. This is actually interesting. It's left a lot of people who work in New York City, right, aren't working in New York City. They're working from home. And I have so many patients who are now not doing that commute and are so much healthier and sleeping better. So it's sort of interesting. It's one sort of aspect that sort of, I think, made people a little healthier, is being able to do telehealth. As you know, we're doing telehealth in this office. Anything that we really can do over the phone, kind of do that anyway. It's kind of the nature of this practice that lends itself to that. But we're doing as much as we can via telehealth as possible. Right now, social gatherings larger than 25 individuals is prohibited. Masks. I read that they are required when entering a business. I'm not positive how true that is. I haven't really been out to many businesses, but I've seen, signs on the outside of every place I've been that have said that people must wear a mask. In-person retail stores are now open. Curbside delivery is always preferable. So if you can get, anything retail that you want curbside or delivered, that's great. We know that outdoor dining is allowed in restaurants. But indoor recreation services like gyms, salon, barber, nail salons, massage, casinos, theaters, those are all closed. Okay, and again, we may see this open up in another week. It's important to, again, continue social distancing under the yellow phase, and businesses do need to comply. So restaurants, it's actually in the yellow phase that patrons must wear masks while there unless they're eating. So if you get up from the table and walk to the bathroom, you're to put your mask on, you're to wear it on the way back, and then you can take your mask off when you're seated. The tables are supposed to be 6 feet apart. That's a regulation. And also outside, obviously, you want to be at least 6 feet from pedestrian traffic walking down the street. It's limited to best to limit more than 10 people at a table. And interestingly, utilizing scheduled appointments for dining so that contact tracing can be performed. Dental visits, most dental practices are open. Okay, for childcare in schools, lots of you have asked, should I send my kid to, preschool or camp? We know that the Bucks County schools are reopening July 1st for summer session. All the schools, and we're looking at, very likely there's plans in development for the counties, for private schools, for the fall. At least for public schools, all schools must submit a plan based on CDC guidance. Okay, what does that mean? So CDC guidance, which is to include mask distancing, cleaning the facilities, monitoring staff and patients for symptoms. Again, each school is apparently responsible for developing their own plan and submitting that for review. You can imagine that, think about a school like, Pennsbury with thousands of students. I mean, unless they build a new school, social distancing in the school is going to be, I'm not sure that that's possible, right? To do 6 foot distance between students, there's just simply not enough room. So it's very likely we're looking at sort of hybrid models where they may have kids going to school, some kids going to school on certain days, some kids going on other days, doing home learning on other days. It does get trickier in the public school system where you have some socioeconomic barriers to kids who don't have internet at home. That's been a lot of the limitation. So the bottom line is that nobody has a distinct plan for what's happening in the fall. Everybody's sort of in these are the things we're thinking, and we'll know when we know. Okay. Some colleges, I think, have more specific plans in place. I just heard yesterday that Princeton is not resuming and may not resume till 2021. They're going to be doing all distance-based learning, at least that's what I heard as of yesterday. So the point is we really don't have a great answer for when all of this is going to happen. And I think even when we go to green, there still has to be some of the measures in place. It's thought that if the risk is mitigated, now we open back up on June 5th, so by June 19th, if the government feels that the risk has been significantly reduced enough, then we'll move to phase green. Okay, so here's a really strong point I want to make, is that, just because something is allowed, meaning like, okay, now we're in green phase, we're allowed to do all of these things, it doesn't necessarily mean that's the right thing for you. Okay, so you can't assume that, we're in green phase, that means everything's okay. It really depends on your wishes, your preferences, your health. All of those things have to be considered, and you can imagine that means there's no clear answer for everything. And I'll try to cover some of the questions you guys asked about my thoughts on that, because again, there's not going to be hard, fast recommendations for a lot of these things. There was a really cool article that was published in the New York Times on June 8th, and they surveyed 511 epidemiologists, and all of them were to comment on when they might return to activities like hugs, handshakes, being in a group with others, even like people who weren't their family, dining out, seeing your doctor, sending your kids to camp and school, riding a bus, subway, flying, getting a haircut, going to a nail salon, going to a movie, concert, sporting event, attending a wedding or a funeral, going to church, and when you might stop wearing a mask. They asked 511 epidemiologists, and the responses were all over the map. So these are people who are trained to track disease, to understand how disease works, and all of them could not come to a consensus of when it's okay to do a lot of these things. So I know a lot of you guys want answers of when you can do things, and I'm going to tell you today that we're probably not going to have those answers. It's really going to be dependent on time and your own situation. But it's evolving, okay? So we're going to get more answers as we move forward. All right, here are some things I'm thinking for basic recommendations. So groceries, right? So there's not really clear evidence that food or food packaging represents a significant role in spreading. So coming home, taking everything out of your bags, disinfecting everything, it is not felt at this time that is necessary. If you want to do it and it makes you feel better, go for it. But it's not felt to be necessary. What I do when I grocery shop, and again, what I do, it doesn't mean it's right for you or necessarily proven, is that I bring my bags in, I put them on one surface, I unpack them, I put everything away, I throw the bags away, I clean the surface where I have the bags, and I wash my hands. Okay, so that's as much as I do, and I think that that's reasonable. But again, if you want to go the course and sterilize everything, you certainly can, but I think that might be a little bit overkill. Mail, again, I have people who just, don't pick up their mail for 3 days. I think you could pick up your mail, get your mail from your mailbox, bring it inside, open it up on a surface, throw away the envelopes, wash your hands, wash the countertop. I think that's probably reasonable. Again, there's no mandate, there's no clear written policy on how to open your mail. Deliveries, again, a lot of us are getting takeout now, and so most of the takeout facilities they'll just leave it at your front door. They'll take your credit card information over the phone. The same thing, I wash my hands after accepting deliveries, unpack everything, wash my hands. Again, there's no real evidence that this virus is foodborne, so getting takeout food is not felt to be a risk for transmission at this time. Avoiding, going inside. So if you can bank online, go to the ATM. When you go to places like the ATM, or you're in a grocery store, or you're getting gas, there's all these little touch pads and things. You certainly could carry a thing of sanitizing wipes with you, and before you touch any of those things, you clean them off. You certainly do that, or you just make sure that when you're done touching those things, you have hand sanitizer on board. I keep hand sanitizer in my car, and wash your hands right after you touch those things. Prescriptions, most pharmacies are now really requesting that you pick up your prescriptions through drive-through. Some are even delivering. Getting your prescriptions in larger quantities as possible so you can minimize your trips to the pharmacy is key. Someone asked about flying, and right now most agree, people who are experts agree that you should avoid flying unless you absolutely have to fly. I just spoke with a friend this week who flew back from Florida. I don't know what airline. Everybody wants to know what airline. I don't know. But the flight was packed. It was actually overcrowded. They were trying to get people to bump people. And masking was not enforced. If you think about that, is like as closed space as you can get. Of course, you're going to be most at risk from the person that's sitting next to you. So very likely you're maybe sitting with someone you don't know, and there's just a high risk there. So certainly if you have to fly, we flew right before the pandemic blew up. We flew back from vacation the first week in March, or I guess it was the second week in March. And we'd known when we were flying back from vacation that everything had changed in a week period of time. So we had sanitizing wipes. I wiped down the seats, my seat, the entire surface, the seat belts, the armrests, the seat in front of me, the table tray. Okay, that's a huge nidus for infection. The window, the sliding door on the window, really minimized. The flight was thankfully short enough. I didn't have to get up to go to the bathroom. My kids did not either. We actually weren't masking at the time because we didn't really know the importance of it, but certainly now, if you're on a flight, you need to mask the whole time unless you're eating. And then just not touching your face, keeping hand sanitizers, washing your hands frequently, bathroom avoidance I mentioned, and then if you have the ability to control where you sit, sitting in a place where there's least likely traffic going to from the bathroom is key. Okay, so if you're sitting in the middle of the plane, people are likely in front of you going to the front bathroom, and behind you are going to the back bathroom, so you're less likely to have people going back and forth. So if you have choice over that, take the middle of the plane. Okay, someone asked about hotel stays. There aren't any clear guidelines. Most people really aren't traveling. If you're staying in a hotel, you're probably flying somewhere. I guess you could be driving to stay somewhere. There are no clear guidelines. My feeling is, we may go somewhere later this summer. We may stay at a hotel versus some friend's house. I'm going to take wipes when I come into the room. I'm going to, come into the room. I'm going to be wiping down doorknobs, wiping down all high-touch surfaces. Fabric, it's fairly felt that virus doesn't really live on fabric. So getting into, the sheets that have been changed by a cleaning person, less likely a problem. Along those lines, if you have a cleaning service that comes to your home, I think at this point it's reasonable, assuming it's not a group of 15 people coming in to clean, that's probably safe. Again, when you get home, if you're worried, just clean down those high touch surface areas. Okay, so many of you asked about visiting family and visiting grandkids. And, I searched up and down for an answer to this. And as I sort of alluded to at the beginning of this talk, there really isn't a great answer to this. You have to really consider your health, right? So if you're 65 and older, you are by nature at high risk. If you have a chronic medical condition, you're at high risk. Remember that grandkids, children, can often be vectors for this. So even though they may not be sick, they may be carrying this virus. So things you want to consider. You want to consider how good those who you're going to be spending time with are protecting themselves. Where are you traveling to? So if you want to have your grandkids down from New York City, I'm not sure that's a great idea. If your family members are traveling from a low risk area, or you're coming from a low risk area to a low risk area, that's probably safer. That's probably a better bet. If you decide to get together with your family members, can you hug? Again, there's no clear answer. You have to kind of do what you're comfortable with, but you may very well be at higher risk. With your age, that might not be a great idea. So it really has to be comfort zone. Okay, do you have to social distance when you go visit? Yeah, it's better if you do that until we know information. But if your situation is such that there's a really there's a really low chance of your family members being infected, then that might be a decision that's okay for you. Masking, the same thing. Outdoors, again, if you can spend time outdoors, that sort of makes a big difference, because then masking is probably less of an issue, less of a risk. Someone asked if you have chronic medical conditions, things like lung disease, what's the best thing for you to do? Well, of course, wearing a mask, of course, minimizing your time outdoors. Someone mentioned that when she goes to the store, she goes at times where it's less likely to be crowded. Absolutely. And again, these are things we kind of all should be doing. We really should all be doing those things, because again, even though those who are older or have medical conditions are more likely to get sick, there are people who are really healthy who can still get sick too. So you don't want to have a false self-confidence either way. Going to the doctor, dentist, we know that there's been, obviously, we haven't been seeing any routine visits here in the office, and there's been a significant impact in delaying care. We estimate that cancer screenings, missing those are going to lead to more cancer diagnoses. Vaccination rates are very low, especially in children under 2, so that's scary. So it is important that people do resume their medical care. And so if you're concerned about your doctors or dental offices, questions that you can ask, are the staff wearing masks at all times? Of course, we should be wearing a mask at all times. Do patients who come in wear masks? They should be wearing a mask when they come in. Does the office have sufficient personal protective equipment? Do we have enough masks here in the office? How many people are sitting in the waiting room? If your waiting room is open, how many people are sitting there? Is there a social distancing measure in place in the waiting room? How often is the waiting room cleaned? How often is the office cleaned? Are they screening patients prior to coming in? Most of you who've maybe gone to specialists, those sorts of things, we do get a screening of your symptoms before you go into a visit. Virtual visits are, of course, important when possible. Okay, if you have a broken arm, a virtual visit isn't going to be great to have with an orthopedist, but things that can be done virtually are obviously better. And we're actually looking at, even post-pandemic, when this hopefully is all sort of calmed down, that telemedicine is actually going to become something more widely accepted, because it's actually being nicely embraced by many, both doctors and patients alike, because it's in many cases more convenient and saves unnecessary trips to the doctor. And then when you're when you come into a doctor's office. I said you bring your own mask. Most doctor's offices should have masks available, and then wash your hands post visit. We are in our practice, again, doing virtual visits when possible. We only have necessary team members in the office, myself, Michelle, and Kim. Jordan is going to be coming back July 1st. She'll be sitting in the waiting room area, but we are not utilizing our waiting room area for patients to sit in. So she's got her own space there. Kate, our office manager, works from home. We are team members. We're checking ourselves, each morning for symptoms to make sure we're not sick. Temperature checking. We are avoiding overlap of scheduled patients, so we're really trying not to have any more than one person in the office at a time. And if they are, avoiding any cross, contact with them. Again, they are wearing masks, so that should sort of negate that. We do temperature check and masking when you come into the office. The doors are locked, so when you come in, there's a doorbell, and then we will come to the door to let you in. And then all room surfaces and equipment is sanitized after each visit. If you've seen me during this, when I come in, I'm wearing a mask. I sterilize my stethoscope with a disinfecting wipe. I wash my hands for the 40 seconds, and do all of those things when I'm done. And then Michelle will come in. She cleans the entire exam table, changes the paper, cleans the whole entire countertop, doorknobs, chair, everything. And Michelle is extremely diligent when it comes to preventing infections. She was like that before COVID. So you can feel safe that when you come in here, we're taking all the appropriate measures. When you leave, we sterilize the doorknobs. Every possible surface that you may have touched or that we're touching is being cleaned on a regular basis. Okay. Again, just touching again, if you're over 65 or have chronic medical conditions, you should have a much higher threshold for leaving your home. I wish I could give you a different answer, but I cannot do that today, unfortunately. All of us, to keep us well, should be hydrating well, eating healthy, getting enough sleep, staying active. Exercise is key. Okay, so all of those things, thankfully the weather is nicer now. It's not too hot. It's certainly not cold. That, if you can't go to your gym, you can get out. You can go for a good walk. It's also good for the mind, too, to be outdoors and to be moving. It's, can help relieve stress. Along those lines, stress management, so many of us are so stressed and worried and anxious about this. And so again, sleeping well, healthy diet, exercising, watch your intake of caffeine and alcohol. Those can actually be, irritants and sort of contribute to stress in excess. Increase your own sense of safety. If you're really taking the right precautions, then you can be less worried about your chance of infection. Stay connected with others, emails, FaceTime, Zooms. If you're involved with a counselor or, a therapist, continue to engage because these times are, particularly stressful. And if you have that need, you want to make sure you embrace it. And again, most mental health professionals that I know right now are doing all virtual visits. Incorporate calming practices, so interact with nature. Try not to get too saturated with the news and media exposure. Again, some of you have asked where's the best source of information. I would like to think that I've really sort of kept up on this, and rather than be reading blogs and those sorts of things where you may get more scared than informed, it's probably a good idea to avoid that. If you're a spiritual person, you want to continue to engage in those beliefs. If you're able to go to church and they're practicing the right measures there, do that. There's a lot of online services that people have been attending. If you have hobbies, you want to sort of embrace those. And then mindfulness, meditation, all of those things, deep breathing, all of those things can help us calm. One of the things I found to be helpful is to optimize your home environment, so spending a lot more time at home. We have, done some improvements to our back deck and made it very comfortable and cozy and a pretty place to be, because we won't be spending our time at the pool this summer. We probably won't be going on a typical vacation, so we're trying to make our home as comfortable as possible. Flowers, decluttering, setting up quiet spaces in your house is important. So that is all that I have on prevention. Again, there may be more information coming out as updates come out. I'll probably be providing some shorter snippet videos as things sort of evolve. But right now, that's as comprehensive as I have. I'll be doing another session on testing and treatment of the virus in the next video. Thanks for your attention.